So I have my PPE on, my scene is safe. Per dispatch, I'm arriving to a 59-year-old female who was involved in a motor vehicle collision at a high rate of speed. I only have one patient. I'm going to request ALS, and due to the mechanism of injury, I'm going to have my partner come over and hold C-spine and to not let go until I instruct them to do so. Adrenaline impression of my patient, she's lying supine on the highway. She doesn't appear to be alert. Hello ma'am, my name is Nicole. I'm an EMT on the ambulance. She's not alert to verbal stimuli. I'm going to sternal rub her, and she is responsive to verbal stimuli. I am going to assess any life threats. She does have a femoral bleed to the right lower extremity. I'm going to have my partner come over and place a tourniquet and time stamp it, and that does appear to control the bleeding. And now I'm going to assess my patient's airway and open the airway. Her airway is clear. There is no vomitus or foreign bodies. I'm going to have my partner place in an OPA to maintain my airway. And there's no gag reflex present. I'm going to assess breathing, assess ventilation, and my patient's breathing is rapid and shallow. I don't see any injury to the chest that could be compromising my patient's breathing. So I'm going to have my partner come over and place my patient on non-rebreather at 15 liters per minute. I'm going to assess my patient's pulse. It is rapid. Her skin signs are pale, cool, and diaphoretic, and I don't see any other major bleeding at this time. I am going to initiate shock therapy. My patient's already lying supine, and she's on non-rebreather at 15 liters per minute. I'm going to place a blanket over her to conserve heat. And at this point, I'm going to make my patient my priority and transport to Natividad Medical Center. And I'm going to have my partner get me a baseline set of vitals, blood pressure, pulse, respirations, and SpO2. My patient's blood pressure is 140/90, her pulse is 120, her respirations are 10, and her SpO2 is 95%. I'm going to attempt to take a sample history and then move into my my secondary assessment, looking for any DCAP, BTLS, deformities, contusions, abrasions, punctures, burns or bruising, lacerations, tenderness, or swelling. I'm going to start with the head, palpating the scalp for any DCAP, BTLS. I do feel crepitus in the occipital skull, looking at the ears for any bleeding or cerebral spinal fluid, and there's none. She does have a battle sign to her left ear. I'm going to assess the face for any DCAP, BTLS. There's none in the face, the nose, the jaw. I'm going to look at her pupils. And her left pupil is fixed and dilated at 8 millimeters. And I'm going to look into the airway again. There's no bleeding or vomitus or other foreign bodies in the airway. Now I'm going to move on to the neck, assessing the neck. I'm going to palpate the C-spine. There's no DCAP, BTLS, or step-offs in the C-spine. Her trachea is midline, and I don't see any JVD. Now I'm going to move on to her chest and inspecting her chest. I don't see any DCAP, BTLS. Palpating the chest, there's no DCAP, BTLS. I'm going to listen to lung sounds in the upper chest and on the sides of the chest. And lung sounds are clear. Now I'm going to move into abdomen and pelvis, palpating all 4 quadrants of the abdomen. and there is no decap BTLS. Now to the pelvis. Shaking the pelvis, there's no pelvis instability. I'm going to inspect the genital area. There's no decap BTLS. Now moving on to the lower extremities. Tourniquet is still in place with the bleeding controlled. Assessing for any decap BTLS. She does have an abrasion to the right knee. And now to the left lower extremity, there's no decap BTLS. I'm going to assess distal CSM, and her pulse is intact. Capillary refill is less than 2 seconds. I'm going to use my finger as a pen to run underneath to check for reflex, and she does have a reflex present. I'm going to twist her pinch her toe to see if she responds to pain, which she does. Now I'm going to assess the upper extremities for any decap BTLS, and there is an abrasion to her right hand. And the other extremity, there is no decap BTLS to the left upper extremity. Assess distal CSM. Her pulse is intact. Her capillary refill is less than 2 seconds. And I'm going to squeeze her thumbs to see if she responds to painful stimuli, which she does. And now I'm going to inspect my patient's back and posterior region. On the heads count, I'm gonna log roll my patient. So on the heads count, 1, 2, 3, and log roll. Inspecting the thoracic and lumbar spine and the sacral region. There's no decap BTLS on the back at all. I'm gonna inspect the buttocks region. There's no decap BTLS. I don't see any decap BTLS to the posterior legs. And on the heads count, I am going to roll my patient back. So 1, 2, 3. Okay. I'm going to assess any secondary wounds that my patient has and reassess every 5 minutes. And this concludes my skill.